and then the camera went into my heart. And the doctor was looking at everything, and he says, okay, we got the one blockage, two blockages. And then I heard him say, there's another blockage, there's another blockage, and there's another blockage. You don't want to hear that when they're in your heart, you know. My name is Gene Miller. Well, I'm a career educator, and I am an adjunct professor at Stockton University in South Jersey. I have 3 children and a wife. My wife and I have been married for 39 years. It'll be 40 years in May. And we have 3 children. My son had just had a baby, and we were walking the baby in a stroller in a park on a beautiful day, and I got 50 steps into the walk into this beautiful park, and I said, I got to take a break. I was feeling really winded, very, very winded. I made an excuse, because that's what you do. You make excuses to cover up. And I said, I didn't sleep well the last couple nights, and I'm a little tired. At that point, I knew something was wrong, but I was never thinking my heart, because I never had any problems with my heart. And I've always been strong and physical, involved in sports and a coach and everything throughout my career. And as we drove home in the pandemic, I started to feel worse. But I said, how could I be this weak? How could I be this out of shape? My breathing's horrible. Got the achiness in my shoulder. I got the tingling and numbness now, and now it's happening all day and all night, where the last 3 or 4 days I couldn't sleep. And that's when I knew something was wrong. And that's when I thought maybe I was having a heart attack. It was very, very scary because of COVID. I was going to wait it out until this COVID wave kind of settled down, and then I was going to go. But what we found out was that Virtua had closed the waiting room, that no one could be waiting in the waiting room for patients that were in there. So everybody had face masks on. I went in with a face mask, and it was a safe environment. Emergency room doctor was very, very, very calm, very professional, and he put me at ease. He goes, if you're willing to remain here for 1 more hour, our stress lab opens, and I will give you a cardiac stress test right here at the hospital, and that will get to the bottom of anything else that's possibly going on with you and your heart and this heart attack situation, because everything you're describing is a heart attack symptom, yet all the reports indicate that you're not having a heart attack. And he popped me on the treadmill, and he ran me, and he took the scan of my heart, and he turned around and he goes, you have 2 blockages in your LAD, he goes, which is called the widowmaker. And one of them is 98%, so we have to get you catheterized and cleared today. He said, good luck, you'll be in good hands, and rolled me into an ambulance. And I've never been on a faster ride from Voorhees to Camden. I was there in less than 10 minutes. Because of COVID, there was nothing on the roads. And then I met Dr. Smeglin, and he came in. He goes, we'll probably go in there and take some pictures. Everything will take about 45 minutes. And we'll know exactly where your blockages are, and then we'll clear your 2 blockages. And then the camera went into my heart, and the doctor was going through, looking at everything. So he goes, we can't do the bypass, we're going to have to go in and we're going to have to do the stents. And then as I was kind of recovering, Dr. Smeglin walked in, and he showed me my pictures of my heart where each of the stents went in at. And these are your 5. He goes, here's your LAD. We had to put 4 stents in your LAD. He said, you're a 1%er. So there's only 1% of the people that have this survive. He goes, typically if you did nothing for another week, you could have a massive heart attack and died. So that's when I knew that I was blessed, and that the Virtua doctors as a team, you know, they, excuse me a minute, they saved my life. And I'm grateful. When you become weakened like that, sometimes you feel guilty because maybe you should have been eating good all the time, or doing more cardio and exercising. You don't think about a lot of the stuff until after the fact. I talked to my cousin Jack, so he goes, listen, I'm having shortness of breath, and he goes, but I also was having like a pain in my back. And I told him my story. I go, you got to promise me that you're going to go see somebody, that you'll go to the emergency room and get checked out. And he said, I will. And I go, no, I mean, I want you to promise me. I want you to say, I promise I will. He goes, I promise I will. 4 o'clock that morning, I got a text message from his wife. They were in the Virtua emergency room in Willingboro. He had had a heart attack. 1 week from the day that I was in the hospital at Lourdes getting a heart catheterization and getting 5 stents put in my heart, he was in Lourdes having 2 heart stents put into his heart, and he had had a second heart attack. And that's why, you know, it's our responsibility as adults to take care of our own health and to go to the doctors or go to the hospital if you think that something is wrong. Virtua has inspired me and has changed my life and my habits, and I hope that I can pass that on to somebody else. Maybe if I can save one person and get them into a doctor, that would be great. Hopefully more.